Welcome to A Journey to Whole Woman Health, the podcast where science, mental health, and faith come together to educate, empower, and encourage women in every season of life. We're your hosts, Dr. Jamie Irwin, board-certified OB-GYN, and Dr. Mary Catherine Nader, licensed professional counselor with a PhD in counseling. Let's begin the journey.
Welcome to Journey to Whole Woman Health. Today, I get the amazing opportunity of interviewing my co-host and great friend, Dr. Jamie Irwin, about how do we find the right OB-GYN? How do we find the right person to care for us? And I'm so excited to get to do this. It's so fun doing this today. So let's get started.
Let's do it.
Let's do it.
Happy to share.
Yay. Okay, so first of all, how about you tell us a little bit more about your story, how you decided on becoming an OB-GYN?
So we talked about in previous episodes a little bit of our background, how we landed in our fields. I was really drawn to OB-GYN because I loved the focus of taking care of women.
Yeah.
And the longer I do this, the more I realize truly how incredible women are.
Yes.
I'm obviously biased, but women do such incredible things. Our bodies can grow a human.
That's amazing.
Our bodies make an organ called the placenta, and then it comes out, and then you can do it all over again and again. I mean, it's absolutely incredible. So, pregnancy, it's fascinating. It's incredible to just walk alongside women during those 40 weeks, roughly. But women experience such pain. I mean, gosh, we go through it, right? I mean,
yes.
The periods, the pregnancy, the delivery, the perimenopause, the menopause, potentially surgery, hysterectomy. I mean, there's just so much, not to mention miscarriage, loss, relationships, identity, our body changing, and, sometimes just not feeling at home in our bodies because of hormonal shifts or stress or whatever it may be, right? So I really just love what I do because I'm constantly in awe of women.
Yeah.
Truly.
That's awesome.
Yeah.
And you're so good at it.
Well, thank you. I've been doing it a long time. So the journey to be an OB-GYN starts with an undergraduate degree that can be in anything. I mean, I could have majored in a foreign language if I had wanted to, but you do have to meet the prerequisites for medical school. So all the basic sciences, physics, organic chemistry, math requirement, all of it, right? There's an admissions test. I'm sure there's something similar for counseling, right? So the MCAT. And then you apply to medical school, which is 4 years. And that's when you really gain this breadth of knowledge in all the different specialties. And then you get to do clinical rotations, which is incredible. You finally get to be hands-on and help take care of patients. And then depending on what you choose, there are varying lengths of residency programs. So when you graduate medical school after 4 years, you are a doctor, either an MD or a DO, depending on your school. And then residency is when you really start learning how to be a doctor. And so for OB-GYN, that's 4 years. And that was probably the hardest 4 years of my life. And I've done some hard things.
Yeah,
I've run some marathons. I was a collegiate athlete. But residency was really a trying time. And it was wonderful. I mean, it was so incredibly challenging. Just the volume of hours, the acuity of patients, how sick patients were. it was a lot. It was really hard, and I'm grateful for every single moment because I know it helped make me the doctor that I am today. So I wouldn't trade it for the world. But those were some, I don't think I'd talk to people much. My family didn't see me. Friends definitely didn't see me.
I remember it being a really difficult time.
Yeah. I mean, we go way back.
Busy time.
So if you don't know, Mary Catherine and I have been friends since we were 14. And we've been there for each other through all sorts of seasons. So, but that was a particularly tough one. Yeah.
Yeah. Well, okay. When should someone first start seeing an OB-GYN? Like, I'm thinking about, my daughter. What age do you typically recommend people start going to an OB-GYN?
Great question. And I get it a lot. A lot of my patients now have daughters and are wondering the same thing. So my answer is definitely by 18. I think that's my personal preference. Before these young ladies head off to college or just head off to whatever is the next step after high school, a lot will be moving out of the house. And if nothing more than to establish a relationship with an OB-GYN. And to be clear, OB-GYN stands for obstetrician, gynecologist. I don't want to assume anything as far as people's background, but so the obstetrics refers to pregnancy care, prenatal care, the delivery of babies. And then the gynecology is everything else in regards to women's pelvic health, reproductive health. Yeah. So 18 is one answer if there's no problems, right? If there are problems.
And what would problems be?
At a younger age, problems at a younger age would be perhaps delayed puberty, delayed menarche, meaning they haven't started their period yet. So age 16, girls should start their period. But it's also normal to start as early as 9.
Wow, yeah.
Yeah. But problems with their period, if it's particularly heavy or extremely painful, if it's interrupting with their quality of life, if they're having to miss school or miss sports or miss activities because of an issue with their menses, that's a problem.
Sure.
We don't want our young gals missing out on life because of their period. Yeah. So, or, if a young gal is potentially going to be sexually active, we want to have that conversation early with the patient, with the mom, and with the OB-GYN. We want to talk about things. We want to empower our young ladies to protect their bodies, to be well informed, to understand what consent is when it comes to sexual activity. We want to talk about pregnancy prevention and prevent an unintended, unplanned pregnancy. So contraception is a big part of my practice, whether that's an adolescent or a young professional gal in her 20s, 30s, or beyond. So it really does matter. There's no clear answer. I wouldn't say every 13-year-old needs to go to the gynecologist. Definitely by age 21, that is when we start cervical cancer screening, also known as a pap smear. So age 21, you definitely need to be seeing a gynecologist, and probably, sooner than that. So 18. I know I'm throwing a lot of numbers out there, but
I think that's helpful.
Yeah.
Helpful to understand. And what should people expect in their well woman visit?
Good question. We've talked about this a lot. Okay. So what is a well woman exam, right?
Right.
Okay. And in that conversation with you, Mary Catherine, was very eye-opening for me because, of course, I approach my day and my schedule from my lens and my perspective, and I only know what I know, and that's OB-GYN. Of course, I'm a patient as well. I have a primary care doctor, I have a dermatologist, I have a dentist, what have you. But What's interesting about gynecology is that as doctors, we expect that preventative health care visit, aka the well woman exam, for that woman to be well, meaning free of any problems.
Mm-hmm. Complications, issues.
Yes, you name it, right? But here's what actually ends up happening. And for many reasons, and I really do get it, okay?
Yeah.
I get it, because my patients tell me, you're hard to get in with.
Sure. Yeah.
I had to schedule this appointment months ago.
And then this thing came up.
Yes.
I can't schedule another. Yeah.
Yeah.
Mm-hmm.
So I really do appreciate that, and I really do get that. But what ends up happening is a woman may kind of store up all the things over the last 12 months that she wants to talk to me about.
Mm-hmm.
Her decreased libido, her breast tenderness, her periods are now irregular. She's having some mood swings. Her PMS is like way more noticeable. On and on and on and on, right? Can you guess what age this woman may fall?
Probably like perimenopause.
So, and I love talking about perimenopause. We are
yeah.
absolutely going to do a whole episode about perimenopause. I think you and I both have such important information to share from a GYN standpoint, from a therapist standpoint, about all things perimenopause. It may be 2 episodes. We may have part 1, part 2. There's a lot.
You never know. There is a lot.
There's a lot. So anyhow, we see this happening. My colleagues and I, we've talked about this. And it's really, it's hard.
Yeah.
It's hard to kind of navigate this because I want to meet all the needs.
Mm-hmm.
I do.
Yeah.
I really do. And it's important that a doctor listen. And it is important for a woman to feel seen and to feel heard, right? And we don't want, I know I don't want any of my providers to seem rushed.
Right.
And I don't want to be dismissed as a patient, right?
Mm-hmm.
So how do we make that work, right? So a well woman is allotted 10 minutes. But if it's a well woman plus problem, I mean, that then turns into a 20-minute visit, 30-minute visit. And then, oh, by the way, I've got somebody in labor and they just called me and I've got to go deliver her. So now I'm an hour and a half behind.
Right. Yeah.
You can see our dilemma.
Yeah.
Right. It's hard. So I don't have all the answers, but a well woman should be, in an ideal world, a woman is well, it is preventative care. It is a pap smear if she needs a pap smear. And there are certain guidelines for when and how often and who needs a pap smear, etc. It's a breast exam. It's going over other health screenings. Have they been done? Mammogram if appropriate. Colonoscopy. Have you gotten that done? Screening for depression.
Which I love that y'all do.
We do. We do for everybody.
Mm-hmm.
It's important. Because in a way we are a lot of women's primary care doctors.
Yes, you are. You're seeing them for all the things, and it normalizes it for them to screen for those things.
Yes,
yeah,
for sure. So there are well woman visits, and then there are problem visits. And of course, sometimes there's some barriers with the front office and the scheduler.
Yeah.
Who may be new to their role. And those are issues we try to work through as well as doctors, being sure our office is running smoothly and patients are getting scheduled appropriately.
Mm-hmm.
So that's definitely a challenge, right?
Yeah. Yeah. What's your favorite part of your job, do you think?
I really love those patients that I've known for a long time.
Mm-hmm.
And I walk in the room and maybe I haven't seen them in a year, but we pick right up where we left off. How are your kids? How's your family? How's your partner? How's your job? How's everything, right? And we do get to catch up. And then they come right back to me, right? Because they care about my life.
Mm-hmm.
They want to know about my family. We may exchange pictures, here are the kids, and oh my gosh, you delivered this one. Look how big they are. Oh my gosh, I love that. That makes my day. having those long-term relationships with patients. We've grown together, right? Maybe we had our babies at the same time, and now we're going through perimenopause at the same time, and we're navigating it together. That really brings me joy.
Yeah. Yay. I love that. What do you think is the hardest part for someone about finding an OB-GYN that's a good fit for them?
It's hard to know where to start. We talked about this on our last episode, trying to find a therapist.
Yes.
Where do you start? And I will tell you that the Google reviews are not always a good place to start.
Oh, same for therapy too.
Yeah. You cannot believe everything that's out there on a review.
Right.
And sometimes there's some really hurtful things that are posted, and, sadly, it can really affect us as doctors.
Sure.
We truly do what we do because we have a heart of compassion and we want to help people. And so when things go sideways, perhaps, I've seen bad reviews for me, for my partners, like because of the parking garage situation.
Right.
And it is horrible.
It's horrible.
It's horrible.
But there's nothing you can do about it.
It's posted to us in our practice or, what have you. So, I would say tread lightly when you're reading the reviews, trying to sort through them, take them with a grain of salt. Word of mouth is always amazing. And that truly is a high compliment for me as an OB-GYN. When I have a patient who has an amazing experience with me that I feel like I connect with, I build trust with, and then she tells her sister or her cousin or her mother or her coworker, that is such a high compliment. And then I would encourage women to ask your trustworthy friends who've had good experiences. That's a really good starting point. Being board certified is important.
Yes.
So let's talk a bit about that. I know
what that means.
You have, as a therapist, you have some very intense licensing and certification processes. So we do as well. So once you finish a residency and are then in the next chapter of your life, so for me, that was private practice. I joined the group that I'm with 13 and a half years ago, the company that I'm with. And then from that, we started Vivi Women's Health. But there are some doctors who finish OB-GYN residency and go on to a specialized fellowship. And that's more training. Those examples are a maternal fetal medicine specialist who works with women with high-risk pregnancies. There are reproductive endocrinologists and infertility specialists who work with infertility, as well as endometriosis, fibroids, but typically those seeking pregnancy who are having challenges. There is a urogynecology fellowship that is a surgical subspecialty of OB-GYN, and they specialize in pelvic floor, prolapse, incontinence. And then GYN oncology, so GYN cancers, ovarian cancer, cervical cancer, endometrial cancer. They do not cover breast cancer. That's a separate specialty. That's not under OB-GYN. So whichever direction you go, whether it's into fellowship or into private practice, once you're done with your residency, you are then board eligible.
Okay.
So these first few years out of training, you are gathering all the surgeries. You're creating a case log. Everything you do is going to be under the microscope. So patients you're treating in the office, those that you're operating on, the babies you're delivering, you keep track of all of these. Once you decide, okay, I'm going to go for this board certification. And sometimes you have to build your practice. Sometimes you're not busy enough for a few years to meet the requirements for the numbers for the case log. So that is a big part of it, creating this case log. There is a written board exam that is done right after residency that you must pass. But then the big test is an oral examination.
Oh, wow.
And not all medical specialties have an oral examination, but OB-GYN does. And that was a tough thing. It's a very long process, of course, gathering all the information for all these cases that you are a part of, and then the studying. So the oral exam, it's an all-day, in-person. Of course, COVID, things changed, right, for a while, virtual, but they actually take place in Dallas. That's where ABOG is, American Board of OB-GYN. So every OB-GYN in the country who's going to take their oral exam flies into Dallas. Their dates in November, December, and January every year. And you sit in this little room with these examiners who are giants in their field, and they ask you anything they want. And it is one of the most intense experiences ever. So I was pregnant with Henry when I took my oral boards, and our daughter Georgia was 3, almost 4. And so she was very much in the pretend play era of her life. And so I'm studying for my oral boards. My husband was studying for his professional engineer exam. And so all she saw us do was just study. Like, if there was free time, mommy and daddy were studying. And so, of course, she started studying during that time, too. She would have a little journal and just scribble. And I'm studying. I'm studying, because that's all that was happening at our house.
So fun.
Yeah. So all that to say, finding a board-certified OB-GYN, it means something. It means that they have gone through this rigorous process where they have sat before experts in their field, colleagues, peers, and really been grilled and drilled on topics that they need to know how to handle. Emergencies, but also day-to-day care of OB-GYN.
Yeah. So what would be, let's say you find an OB-GYN that's recommended to you by family or friends, you have that first well woman visit with her or him, what would be some things to look for and some questions to ask maybe, and what would be some red flags?
Good. Yeah. So having a doctor that listens, I think everything really starts there. It is so easy to get in a rush as a doctor, right? Like, I mean, we're always behind. I know it's true, and I know that's frustrating as a patient. And especially if you have an OB-GYN that is doing the OB portion and delivering babies.
Sure.
Babies come whenever they want to come, and we cannot control that.
Okay.
So if you're someone who is beyond the having babies, you might want to find someone who just does gynecology.
Mm-hmm.
That's okay. They exist.
Mm-hmm.
And that means that they're not going to be called out of the office to go deliver a baby.
Mm-hmm.
Now, I would say there's not as many of those doing gynecology only as those doing both OB and GYN. I myself do both.
Mm-hmm.
But I would also ask about how that's handled. How, what are the wait times like? How is rescheduling work?
Mm-hmm.
For myself, I have hired a nurse practitioner.
Yeah.
And she is absolutely a godsend. She's incredible. She's reputable. She's trustworthy. She's smart. She knows her limits. Mm-hmm. She knows when a patient needs to see the doctor instead of seeing her. She asks me questions. We stay on the same page with treatment plans. And she's able to step in when I'm called out of the office for those deliveries, for those emergencies, and see those patients who are appropriate to see her.
Mm-hmm.
So at least my patients have an option.
Sure.
And they don't have to see her, but they can if they want to.
Sure.
They can also wait on me.
Mm-hmm.
So I think asking your doctor if that's a possibility, If they have a advanced practice provider, nurse practitioner, or physician's assistant, I think that can be a great asset to an OB-GYN.
Yeah.
I think it's important to know the flow of the office. You know, for better for worse, a doctor is not an island. I mean, they cannot do their job by themselves. They're going to have a person at check-in. They're going to have phone personnel who are answering, taking messages, scheduling the appointments. The doctor's going to have medical assistants. So all of that adds up to the experience for that OB-GYN.
Mm-hmm.
And there can be some growing pains. I know I have had that in my practice too. After COVID, during COVID, we had a lot of turnover. We had a lot of turnover in our front and back staff. And there's turnover just that kind of comes with the territory. A lot of these medical assistants are, you know, en route to nursing school or medical school or whatever. And they know it's going to be a temporary job.
Mm-hmm.
So they can come and they can go. But that does make a difference, right? All the support staff for that doctor, it makes a difference.
Sure.
It's important.
Yeah.
So I think asking about that doctor's expertise. A doctor cannot be an expert on every single aspect of OB-GYN. That's why we have those subspecialties that I mentioned.
Mm-hmm.
So, you know, some OB-GYNs are going to be more comfortable perhaps treating early a patient who is experiencing infertility or having trouble getting pregnant, and other doctors aren't going to do any part of that.
Yeah.
And will refer early to a fertility specialist. So asking about what their expertise is, do they operate? Are they really full spectrum OB-GYN or do they have more of a focus?
Mm-hmm.
Is important.
Okay. And then what about red flags?
Red flags for sure. If big red flag, and this should go without saying, but if you ever feel unsafe.
Right. Yeah. Because it's a vulnerable place to be in an OB-GYN office. Yeah.
Absolutely. And along with that, you should always have a chaperone with you. Even if your doctor is female, there should be a chaperone for pelvic exams or transvaginal sonograms.
Like a second person from the staff in the room, typically.
So the doctor and then like a medical assistant.
Yes. Mm-hmm.
Yeah. So that's important.
Mm-hmm.
If you ever feel unsafe, that is a red flag.
Mm-hmm.
Okay. I think if you're not getting good communication, so if tests are done and you don't know the results, you don't know how to get the results, you don't know who to call, you don't know what the results mean, maybe there's a portal, maybe there's a lot of different ways to try. You should feel very good about what's going on with your medical care.
Mm-hmm.
You should feel like you have a grasp on it. This is what's happening. This is what the results say. This is what we're doing about it, right? Like, if you leave and you don't know what he or she did, said, what the plan is,
Right.
that is definitely a red flag.
Mm-hmm.
I think if you feel minimized or dismissed, we talked about this with counseling.
Mm-hmm.
That's a huge red flag. If you feel, gaslit,
Mm-hmm.
we could definitely talk about that.
Yeah.
There is definitely some medical gaslighting happening,
Mm-hmm.
meaning a provider is trying to convince you that what you're feeling or experiencing is not real.
Right. Mm-hmm.
And it goes back to how you talked about last episode, like they are the only person who lives in that body.
Yeah. Mm-hmm.
And when a patient comes to me and is describing side effects or changes that they're noticing after initiating a treatment, who am I to say that they're not feeling that?
Right.
Even if my textbook doesn't tell me that that's a normal side effect, if they're experiencing that, then they're experiencing that. And that's their reality.
Yeah.
And it's my job to be more creative and figure out what are the other options.
Yeah.
So those are a few other red flags. Can you think of any from any of your experience in OB-GYN offices?
I think, well, a big thing for me is obviously them being comfortable with and talking about postpartum depression, perimenopause, just being able to say to patients up front, here are some normal things you might experience. You might, just like you would say about breastfeeding or about labor pains, like you might also have these weird, intrusive thoughts that scare you, or you might have this sort of feeling, or for perimenopause of, these mood swings, or just kind of normalizing any sort of those also mental health symptoms and looking at the whole picture.
Yes.
So, which is always great. And a lot of OB-GYNs, to me, it's important that they're comfortable prescribing some medications for those. I mean, obviously referring to a psychiatrist if it feels out of their league.
Yes.
But being comfortable to understand like with the medications that are helpful. And I know you do that, and it's huge because it just normalizes it for patients.
Absolutely. Yeah. You mentioned some great things. Being willing to refer out. So recognizing I have limitations.
Sure.
There are things I do not know. And that's important for patients to hear.
Yes. For every profession, like we all have to lean on each other and work together. That's why your team, building the patient's team is so important.
I think another is recognizing the whole woman.
Yes.
Right. And
mental health goes with physical health. All of it goes together.
Yes. But being willing to go past, I'm just going to do this pap smear.
Yes.
For example, I might have a patient who is postmenopausal, and she's putting on a little bit of weight and wants to talk about that, right?
Yes.
And so I ask her about her activity. Well, patient A, she's a rancher. She lives out here west of Fort Worth. She is hauling hay. She's in her 60s. It doesn't matter.
Yeah.
She is working the horses, feeding the horses. Like she, how I guide her on her physical activity is going to be much different than how I guide the 60-something who is sedentary, retired, not doing much.
Right.
So we have to treat each person as an individual.
Yeah.
And look at them as a whole woman, right? I mean, that's what we're here for, right? Whole woman health. But if I don't move past that and really get curious about what does your whole life actually look like, I'm not going to know.
Yeah.
I'm not going to know that she's already doing very strenuous activity, and me telling her that she needs to walk is not helpful.
Right.
So, I mean, I feel that too. If I had an issue with, my knee or what have you, and I go to my doctor, my primary care doctor, and they don't ask me about my activity, they don't know that I'm training for a marathon right now, and they just tell me to not exercise for 6 weeks,
right?
That's not going to work for me.
Whoa.
So you've got to really move past that point and look at their whole life.
Yeah.
And if your doctor's not doing that, I would say that's a red flag.
Sure. Yeah. Not seeing you for the whole person that you are. I love that. Okay. Well, any other thoughts you want to throw out there just about people looking?
I think it's okay to, if you're unhappy with the care you're getting, not that women need permission, but I just want them to know that it's okay to go see someone else.
Yeah.
You have options in most places. We're so blessed in our city that we have options. There are so many really great OB-GYNs right here in Fort Worth. That's not the case everywhere. I realize that, but we do.
Yeah.
And if it's not a good fit, that's okay.
Yeah.
That's okay. I think there needs to be mutual respect from the patient to the doctor. I think it's okay to really set forth expectations on both sides, right?
Mm.
The patient expects high-level care, evidence-based care. The patient should expect timely communication with results and what the plan is. The patient should expect that their questions get answered.
Yeah.
And I think from the provider standpoint, a doctor should expect open conversation, an attempt of compliance, respect for their staff
Yeah.
and for them, and at least an effort to comply with the treatment plan.
Sure. Or to be honest and say, hey, that's not going to work for me. Here's why.
Yes. Or,
Yeah.
hey, I tried it, but I stopped it because X, Y, Z, right? Like, just tell me.
Yeah.
Didn't work out?
Right.
Great. Let's do
Right.
something else.
Yes. So often people tell me, oh, yeah, I stopped the medication. I'm like, did you let your doctor know? No, I didn't. You need to let them know. Like, you need to talk to them about, don't just go off of it.
Because there might be other great
There
options.
might be other options. That's right. Yeah. And they don't. And again, as providers, we don't know unless they tell us. We just don't know.
Absolutely.
Yeah.
So communication is key for sure. OB-GYNs work hard.
Y'all sure do. Yes.
We're one of the few specialties that, still does the call.
Yes.
My group, we will do 24-hour shifts where we're in the hospital for a full 24 hours, delivering the babies and taking care of all the women who need care. Thankfully, I don't do that terribly often. It's a really amazing setup that I'm grateful for every single day. But just know that your doctor's working hard.
Yeah.
And he or she is doing it because they really love it.
Love it. Yeah.
They're passionate about it. They have a heart for women. Because it's a tough job.
It is.
It is.
Sure.
But I do love it.
Yay. Well, thank you so much for just sharing and for educating us all on what to expect and what to look for. And this has been another episode, and we hope it's been helpful for you.
This episode, we would like to highlight Justin's Place. Justin's Place has a mission to positively impact a child's life by empowering mothers, mentally, spiritually, and physically, so they can live independent, crisis-free lives. The core program at Justin's Place is The Nest, which has recently opened and is a stable, affordable housing and residential setting designed for these special families. If you'd like to get involved with Justin's Place, support them financially, or as a volunteer, please go to their website, justinsplace.org.
Thank you for joining us on a journey to whole woman health. If this episode encouraged you, share it with a friend, leave a review, or subscribe so you don't miss future conversations. Remember, your questions matter, your health matters, and wholeness is a journey. Until next time.
Now for the legal language. This podcast is for educational and informational purposes only and is not intended as medical, mental health, or professional advice. The information shared on a journey to whole woman health is not a substitute for individualized care, diagnosis, or treatment from your own physician, mental health provider, or qualified healthcare professional. Always seek the advice of your personal healthcare provider regarding any medical or mental health concerns. Never disregard a delay seeking professional care because of something you heard in this podcast.